Hi, and welcome to this brief module on the anatomy of cranial nerve number 7, the facial nerve. The facial nerve is a mixed cranial nerve with four main functional components. A motor component supplying the muscles of facial expression and other muscles that develop from the embryonic second pharyngeal arch. General sensory components that innervate parts of the auricle and external acoustic meatus. Special sensory components that carry taste information from the anterior two-thirds of the tongue, as well as preganglionic parasympathetic fibers that are associated with secretions from the lacrimal glands, nasal, oral, and nasopharyngeal mucus glands, as well as the submandibular and sublingual salivary glands. Let's review the course of the facial nerve. The facial nerve has two main roots that arise from the lateral surface of the pons at the cerebello-pontine junction. Here, we can see a larger motor root that arises from the facial motor nucleus in the pons and forms the larger aspect here. Our second area is the sensory and parasympathetic component of the facial nerve, called the intermediate nerve, the smaller branch seen here. Both roots of the facial nerve lie lateral to cranial nerve number 8, the vestibular cochlear nerve, and together will enter the internal acoustic meatus in the petrous part of the temporal bone. Within the petrous part of the temporal bone, the facial nerve moves laterally and inferiorly, passing towards the bony labyrinth of the inner ear. Here, it turns acutely, forming a bend called the genu. The genu at this bend forms a cluster of sensory cell bodies, forming the geniculate ganglion. Importantly, at this branch, we also can see rise to the greater petrosal nerve, which courses anteriorly through the medial cranial fossa, entering the pterygoid canal. This has a functional component of being a visceral efferent carrying parasympathetic fibers that are preganglionic into the pterygopalatine ganglion. We can also observe a branch called the nerve to stapedius branching within this facial canal and entering the tympanic cavity to help dampen vibration of the ossicles by innervating the stapedius muscle with general motor components. Moving through the facial canal, we can also see the chorda tympanae nerve that passes through the tympanic cavity and enters the infratemporal fossa. As it moves distally, the chorda tympanae nerve will join the lingual nerve, a branch of cranial nerve V3, or the mandibular branch of cranial nerve number 5, the trigeminal nerve. Importantly, the chorda tympanae nerve carries taste fibers from the anterior two-thirds of the tongue, making it a special sensory component, as well as preganglionic parasympathetic fibers that synapse in the submandibular ganglion. The facial nerve then courses distally and exits at the stylomastoid foramen. Here, we can see the posterior auricular branch that courses posterior to the external ear and carries general sensory information as well as motor innervation to the occipital belly of occipitofrontalis muscle and small auricular muscles. It also carries sensory information from the skin of the external ear. Continuing distally, we can see the nerve to the posterior belly of digastric and stylohyoid muscles that directly enter the muscles to provide skeletal motor innervation. As we continue to follow its course and come up on its terminal branches, we see the nerve enter the parotid gland, forming the parotid plexus. 5 major branches of the plexus will emerge from the margins of the parotid glands that supply the muscles of facial expressions. Importantly, while this nerve does pass through the parotid gland, the facial nerve does not innervate this gland, instead providing motor innervation to the muscles of facial expression. namely the temporal branch, zygomatic branch, buccal branch, marginal mandibular branch, and cervical branches, seen arising here. Thanks for following along.